sinus sufferers out there, we're offering a little hope today. You don't just have to deal with it like our next guest did for years.
Yeah, she's Jenny Kaysen, a patient of Dr. Madan Kandula, and he's with Advent, which stands for Advanced Ear, Nose, and Throat Specialist. Good morning to both of you.
Good morning.
Thank you so much for being here. Let's talk first about just numbers, because especially now with allergy season being as bad as it is, now as we get into fall, how many people do you think suffer from chronic sinus problems?
It's been documented, about 10% of the population. So 37 million, which if you think about it, okay, well, that's about 10%. So that's a lot of people.
That is.
1 out of every 10 Americans walking around has these sorts of issues.
And when we say chronic, what does that mean? Because we say chronic sinus pain, chronic sinus sufferers.
Right. I mean, it's kind of what it sounds like. I mean, there's a technical definition, but it's basically folks who have infections that don't go away, or folks who have infections that are repetitive and they can go away for a bit and come back. Or and then another category is folks who just have blocked up noses that don't work for them.
And is that due to a person's own anatomy, just kind of how it was formed?
Typically on both fronts. So on the sinus front, it can be typically due to problems with the sinuses not draining properly, and on the breathing front, it can be a lot of times, a lot of folks, about 1 out of every 5 Americans actually walks around with a plugged up nose from anatomic issues that and they don't know about it.
Yeah, but I think everybody notices. I mean, we all know somebody who has a sinus problem or that stuffed up feeling. Jenny, you are one of them, and you actually remember your very first sinus infection in what, 7th grade?
7th grade, yes.
And you just dealt with it? How did it affect your life?
It was, like you said, it was ongoing for me. And in 7th grade, when I had my first sinus infection, I was telling you beforehand that my dad actually was the one who took me to the doctor, which is rare in our family. Normally it was my mom, so thanks, Dad. And I just remember sitting in the doctor's office thinking, the pressure on my head was just awful.
It can be terrible.
It was horrible. And
did that repeat then throughout your life?
It did, and it was every single day. I remember telling my husband that I would have to take an allergy sinus pill in the morning, 1 in the afternoon about 3, and then 1 before I went to bed, because I just couldn't breathe right. And it was basically every single day, and I was trying to pinpoint it down to maybe I have seasonal allergies, but it would happen in the summer, it would happen in the spring, it would happen in the fall and the winter. So
you finally got a hold of Dr. Kandula, and you had surgery last year in 2008.
I did.
What procedure did you have done, and how did it affect your life after you got it done?
I think probably, and maybe you can expand on that, Dr. Kandula. But I did have several.
You had surgery?
Yeah, she had balloon sinuplasty, so opening up the sinuses, septoplasty, straightening out the septum, and then shrinking down the humidifiers. So 3 procedures, took about 40 minutes to do, and outpatient sort of surgery.
Oh, each one is outpatient?
Yeah, it's all at the same time. So we did, those 3 things happen in, 40 minutes.
Oh, so all 3 of those things happen on the same day.
Yep.
Why was it important for her to have multiple procedures in order to get the kind of relief that she has today?
She had multiple issues. So you've got to, that's the hard part, is a lot of folks walk around with trouble and kind of get, sort of passed around, and nobody really gets down to the bottom line. And so in her situation, she had a CAT scan of the sinuses, which really reveals the issues. We figured out what was going on, and we were able to kind of come after each of those issues separately, or specifically on each front. So.
Was there a lot of downtime for you? Did it take a lot of time for you to recover?
Honestly, the first 2 days, I would say, were, I felt really stuffed up, really bad sinus infection feeling. Yeah. But then it slowly got better, and within a week, I was, same back to where I was.
So what are the results now? How do you feel now?
Well, I think you said it. I kept treating the symptoms over and over again, and what did it for me to see Dr. Kandula was that I was on 3 different cycles of medication for a sinus infection, and it did not go away. And I thought, my body's not responding to this anymore. I need to get to the root of the problem. So that's when I saw Dr. Kandula. And now, knock on wood, I haven't had a sinus headache, which I used to have at least 3 or 4 times a week. I have not had one since my surgery.
That's incredible.
It is incredible.
In some ways that you had done surgery earlier?
I do, but I don't think that I would have done the old sinus procedures where they talk about, impacting your sinus.
Nose.
Yes, exactly. that's what frightened me. But when I, spoke to Dr. Kandula, and I said, what would you do? And he said, well, you can either suffer with it, or we can just fix it and get it taken care of.
And did it influence your decision that Dr. Kandula pioneered some of these procedures here in Wisconsin? I mean, he's at the forefront of all the latest technology. Was that kind of the okay for you to go ahead and have that surgery?
To not sound like an advertisement, it really was. It really was, because I knew that it was state of the art, and it wasn't the packing of the sinuses. It was going to be, something that could help me, and it wasn't like it wasn't in the old days. So I was willing to take that chance.
And there must be a lot of, you must have a good feeling from improving people's quality of life, because anybody who's had one sinus infection knows how uncomfortable it is, and to have a chronic problem and to be part of helping to improve somebody's quality of life is huge.
Yeah, it's a great job. It really is. So it's a great sort of service, or whatever you want to call it, to be able to affect a change like that. It's not life or death sort of things, and so it in a way, because it's not that way, a lot of people just sort of suffer and suffer and suffer, and there's really no need.
Exactly.
Is that your advice to people who suffer from chronic nasal and sinus problems? You don't have to go through this?
Yeah, I mean, I think if the medicines do the trick, if that's the answer, then the problem's solved. If they're not doing the trick, then there's something else going on, and why not figure out what that is?
Definitely. Thank you both so much for being here
Thank you.
This morning. Nice to have you. We're going to give you the information for Advent right now. Again, it stands for Advanced Ear, Nose, and Throat Specialist. You can reach Dr. Kandula at the phone number on your screen. His office is on Mayfair Road. There's also a website for more information. It's advent.md.
Still ahead, tips for improving